The first stop in our journey to unearth the truth behind the state of public health institutions began at the Moi and Teaching Referral Hospital here in Eldoret. The Moi Teaching and Referral Hospital in Eldoret is touted as the country's second largest referral hospital. And true to its name, it trains students mainly from the Moi University School of Medicine and a host of other institutions in the region. Public relations aside, the situation within the hospital is different. The side that meets a visitor to the wards is shocking. Beds meant for one person are shared by at least two patients. Many a times critically ill patients are forced to sleep in turns. This situation obviously exposing the patients to contracting disease from other patients. The hospital's washrooms are equally appalling. Not very far from the institution is a private hospital by the name Eldoret Hospital. A far cry from the crippled referral hospital, those who have some money will have the advantage of accessing health services that remain a mirage to the majority of Kenyans.
This is a one-stop treatment where they will get services of doctors, laboratory, x-ray, everything at one place. They come, get all the treatment, get the drugs and go back to their duty without going to any other place.
The situation is replicated at many other institutions across the country. A scenario so grim when Health Minister Anyang' Nyong'o made a trip to the Rift Valley Provincial General Hospital in Nakuru. Scenes such as this, where two patients are seen sharing a bed, are hidden from him. This ward is obviously overcrowded. Relatives mandated with the task of ensuring their relatives are well kept. The understaffed workers overwhelmed by patients' demands. And with shrinking public financing of the health sector, things took a turn for the worse. Now security personnel at the hospital are keen on who walks in or out, forcing the patients to be caged in the wards, at least to keep prying visitors like us out of the way. So much to hide, nobody to talk to. Stay tuned for part 2 of the series on our special report on the grim situation of our public health institutions next week. Jonathan Ameka, Citizen TV. Evidence of neglect is a glaring reality at most public health institutions. At the Rift Valley General Hospital, these old structures have neither been improved or upgraded. The hospital, which initially served as an army base, now houses the provincial hospital that serves thousands of people, minus the relevant improvements critical to dispensation of health services to the people in the region. The institution's cars are also run down. Maintaining of facilities seems like a far-fetched idea. Ambulance services are also non-existent. In Kisumu's Nyanza Provincial General Hospital, same story, different cast. We take a walk into the ward that houses HIV and AIDS patients. Many of them lie in pain, unattended. When to receive their treatment, nobody could tell us. And like in Eldoret, those who have the finances in the lakeside town do not have to struggle for the scarce resources at the referral hospital.
Usiku si mzuri, mchana afadhali. Hata kama mtu anajua wewe lakini inapitika haraka. Lakini usiku daktari anaenda analala. Hata nilipeleka mgonjwa yangu nilitoa mtoto shule. Nikagonga wana mpaka nikatoa mtoto si kutibiwa hata. Nikapeleka hospitali nyingine Nightingale. Ndio hivyo naona kama wanaweza safanyia survey ya jioni inaweza kuwa ngaa. Usiku hakuna service.
Muda mwingi unasumbuliwa. Madaktari muda mwingine wanakukalisha, wanakupeleka polepole na unaumia kweli kweli.
Kenyatta National Hospital serves as the largest referral hospital in the country and region. In the recent past, the institution has been plagued by staff pay disputes and overcrowding as well as hints of other scandals. At the Rift Valley Provincial Hospital, the cry is for better pay. This, regrettably, from the people mandated with offering health care to the sick. A demoralized, overworked lot, struggling to cope with the surging number of casualties at their workplaces.
Ikafika mahali tukasema ya kwamba lazima tusukume kidogo na ili tukaweza kupata haki yetu. Na kwa hivyo tunasema leo lazima haki yetu tuipate. Tumekuwa tukipata mshahara wa shilingi 3,445 kwa watu wa chini. Au wengine wanapata 5,350.
The health system in the country has been riddled by scandals such as the misappropriation of funds by the Kenya Medical Supply Agency or the swindling of funds meant for purchase of antiretroviral drugs. This sheer neglect one of the many reasons in the rising number of deaths in public health institutions. Efforts are however underway to remedy the situation. A recent announcement by Finance Minister John Michuki that the government is planning to build a hospital in the Eastlands area of Nairobi to ease the congestion at the Kenyatta National Hospital comes as welcome news.
We have today signed 2 economic and technical agreements for the construction of a hospital in Eastlands of Nairobi and the maize flour processing factory in Bomet, all amounting to Kenya shillings 689.5 million for the hospital, which will greatly decongest Kenyatta National Hospital, especially in handling referral cases.
A step in the right direction, you'd say. However, a lot more still needs to be done to remedy the grim situation and ensure the national health system is able to offer quality and affordable health care to all. Jonathan Ameka, Citizen TV.